What is sepsis?
So if you think about how we treat infection, sepsis is basically an overwhelming response from your body to an infection. So it can be deadly. It leads to multiple organs to fail in your body and can be a pretty serious disease that we see, quite frankly, a lot in our ICU and even on the floor here at St. Mary's.
Why is it so important to treat sepsis quickly?
So sepsis is our number one killer in the country. It's a very overwhelming, fast-paced disease. So the only super weapon that we have to make our patients better is to treat as early as possible. And there's been tons of studies on that the earliest treatment, the better. If you think about sepsis, really, if we don't act fast and do the appropriate treatment, mainly antibiotics, then people actually die.
What are we doing here to get quick treatment to our patients?
So we've been working for several years on doing things. We do have standardized processes in place. The thing about sepsis that is, that marks itself from other diseases is we absolutely have to have a teamwork. So this is not only a physician that treats the disease, but these are different layers of healthcare providers, nursing, doctors, respiratory therapists, pharmacists, so on, phlebotomists, so on and so forth. And we all have to convey to one goal to make the patient better. But to do that, it takes a very strong team approach to make things happen really fast. So we do have a process that we call code sepsis, just like when you hear code MI or code stroke, where somebody has identified that this person will meet a definition of sepsis and sepsis criteria, and we can start the process really quickly. And it takes a whole village to actually take care of these patients, hence why all hands on deck when the code sepsis is called. It's not only just the physician giving the antibiotics, for example. So sepsis is the ultimate disease where you need absolutely very strong collaboration between healthcare providers to make our patients better.
Yeah, we see 150 or so sepsis patients every month, and in those cases where the code sepsis process is followed, our patients get antibiotics sometimes in 15 minutes or less, but always within 60. So that code sepsis process is really working in our patients' best interest to get them the treatment that they need, and those patients are having better outcomes.
As far as a ministry, we're one of the leaders in the region, and as far as our region, we're the leader at the system level. And SSM system is actually a nationwide leader when it comes to sepsis. So, but it all starts really with our efforts here at St. Mary's to save our patients.